Cancer is a complex disease. Even within the same tumor type, for example breast cancer, there are many biological and molecular differences that can impact prognosis and treatment response. Since 1998, when it was first recognized that HER2-positive breast tumors responded to trastuzumab, there's been much research regarding different biomarkers and genetic variants that might impact prognosis and response in cancer patients. Whole exome sequencing allows a much broader view of the genetic landscape of a tumor. However, although whole exome sequencing is available on a clinical basis for cancer, the question remains whether or not the information gleaned from whole exome sequencing translates into improved outcomes for cancer patients. To answer this question, we used a proprietary health technology assessment methodology to evaluate the evidence base behind whole exome sequencing in cancer. For each cancer included in our research, there were at least 3 different studies with a minimum of 10 patients per study. The evidence regarding analytical validity for whole exome sequencing was limited to 4 studies, 3 of which used healthy controls and just 1 of which used tumor specimens. Therefore, the information regarding the specific analytical challenges associated with tumor specimens is very limited. Of the different tumor types, breast cancer is the most widely studied, with 7 studies identified. Fewer studies were identified for other cancers, including leukemia, prostate cancer, and ovarian cancer. Most studies done to date focus on the number and type of variants in different tumor types, and few or no studies have been done evaluating the clinical impact of these variants and how this information might be used in the treatment of patients with cancer. Therefore, more information and more studies are needed with a longer follow-up and more patients in order to truly assess how information from whole exome sequencing can be used in the treatment of patients with cancer. There were 3 studies that provided evidence of the potential for clinical utility in whole exome sequencing. These studies looked at specific variants in specific genes and predicted the response to treatment in a given patient based on those variants. However, there are no studies that directly evaluate how using whole exome sequencing information translates into an improved outcome in patients with cancer. In summary then, although information is accumulating regarding the number and type of variants in different cancer types and their association with different tumor types, more information is needed in order to assess the value of whole exome sequencing in the care of patients with cancer. Further studies are needed in order to prove this technology in a clinical setting.